Medicare as we know it could be on the verge of massive transformation. President-elect Donald Trump has nominated Dr. Mehmet Oz to lead the Centers for Medicare and Medicaid Services. With more than 66 million Americans on Medicare, there's a lot at stake. So, if you rely on Medicare or you are planning to soon, this video is for you because the future of Medicare under Trump with Dr. Oz leading CMS could dramatically change how this program works. From Medicare Advantage plans to potential budget cuts and new policies, these changes could affect everything from your coverage options to the price you pay for healthcare. I'm Callie. I'm a licensed insurance broker and certified Medicare expert. Let's get into it and talk about what these changes could mean for you for the next few years and beyond. So let's talk about another key figurehead in the future Trump administration, and that is Robert F. Kennedy Jr. Kennedy has stirred up plenty of controversy over his views on, and he has been tapped by Donald Trump to head the U.S. Department of Health and Human Services, also known as HHS, which is the agency that oversees Medicare and Medicaid. So Kennedy would technically be Dr. Oz's boss since Oz is set to run CMS. HHS plays a massive role in shaping healthcare policy in the US, so who is in charge of it truly matters. Kennedy's background is all about environmental activism and public health, but he has also gotten some serious backlash for his outspoken criticism of the pharmaceutical companies and mandates. If he takes charge of HHS, and he likely will, his approach could bring less regulation to healthcare, and that could put programs like Medicare at risk. Now let's add Dr. Mehmet Oz to the mix.
Coffee, it's the most talked about topic. Everybody wants to know what's the newest, fastest fat buster.
Yep, that Dr. Oz from TV, and it gets even more interesting. These two, Kennedy and Oz, could drastically change the way healthcare is delivered in America. Dr. Oz has been chosen by Trump to run CMS, but Oz is most famous for being the host of the Dr. Oz Show and for his career as a cardiothoracic surgeon. His medical advice has been, let's just say, controversial, with critics questioning his promotion of alternative treatments and pseudoscience on his daytime TV show. His expertise has been more focused on individual medical practice and media rather than managing a complex system like CMS. And CMS doesn't just oversee Medicare, it also oversees Medicaid. And these two programs provide health insurance to more than 155 million Americans. Running an agency like this should demand a deep understanding of healthcare policy, running large-scale administrations, and managing billion-dollar budgets, since about a quarter of all federal spending runs through the centers. Medicare alone accounts for $1 trillion in annual spending and has over 66 million enrolled. So what does all of this mean for the future of Medicare and Medicaid if Dr. Oz is confirmed under Trump? Well, if you look at his past, there are concerns that he'll push to privatize Medicare. Oz co-wrote a 2020 Forbes opinion column and argued for a universal health coverage system where every American not covered by Medicaid would be enrolled in a private Medicare Advantage plan. And this program would be funded through a 20% payroll tax, half of which would be paid by the employee. And that's where Medicare Advantage comes into play. Medicare Advantage plans are publicly funded but run by private insurance companies. And over the years, they've gained in popularity and criticism. And contrary to what critics say, there are positives to Medicare Advantage plans. They do offer more benefits, and they do have a max out of pocket that you just don't get under traditional Medicare. But they do have network restrictions, prior authorizations, and denials, and that makes them less flexible than traditional Medicare and can make them harder to navigate. But it's easy to see why these plans appeal to someone like Oz, especially given his background in promoting private healthcare options. Now, Trump's next administration already shows signs of favoring Medicare Advantage over traditional Medicare, and that's because it shifts the costs and risks to private insurance companies away from the federal government, potentially saving them more money. The problem with this is more private insurance involvement could take away from the accessibility and stability of traditional Medicare. And when you have 66 million Americans relying on Medicare for basic health care, should we really let private insurance companies take over more of the process? It's not just about the potential for less transparency or higher costs. It's about making sure that seniors have access to a healthcare system that they can rely on as they go into retirement. Because what happens if Medicare as we know it no longer exists? Who does that fall on? Do your kids or grandkids have the money to take care of you in your older age? Traditional Medicare, as it stands, provides guaranteed rights and benefits that many people need and rely on. Medicare Advantage, on the other hand, for some can feel like it has more hoops to jump through and harder to navigate. Now, let's shift gears and talk about President elect Donald Trump's role in all of this. If you think about past policies on Medicare, you know one thing is clear, and the budget is at the top of the list. Trump promised during his 2016 campaign not to cut Medicare, but we have seen that this current nominees suggest otherwise for his next term, with Elon Musk chosen to lead the Department of Government Efficiency. Musk has set a target of $2 trillion in savings. If Oz takes the reins at CMS, which he likely will, so we might see some serious cuts to Medicare spending. Cutting costs usually means reducing benefits. And with Trump's history of pushing for tax cuts and a shift towards privatization, makes it even more likely that those on Medicare could see fewer services or more restrictions in coverage in the future. Instead of protecting the program that millions of Americans depend on, the goal may move more toward making the system leaner by trimming the fat, so to speak, which could really end up harming the very people who need those services the most. And we already know what happens when health services are underfunded. It leads to people being denied care, longer waiting periods, and higher out of pocket costs. Moving on to potential new policies, if Dr. Oz leads CMS under a Trump administration, drug pricing will likely become a central focus, especially since drug price negotiations are supposed to continue into next year under the Inflation Reduction Act. These negotiations face legal challenges from the pharmaceutical industry, and Big Pharma has already challenged some of the changes under the Inflation Reduction Act. So it will be interesting to see how those legal challenges unfold and how Oz's role in this will play out, since he has past investments in major pharmaceutical companies. Depending on who you ask, this may raise concerns about conflicts of interest when shaping policies, especially if there is a battle between reducing costs for consumers and protecting corporate interests. Privatization of Medicare, focusing on Medicare Advantage plans, could potentially limit coverage for chronic conditions and increase costs for seniors. People are worried that this shift toward privatized care might reduce transparency. And Oz's limited experience in managing large scale healthcare systems has sparked a lot of concerns about his ability to lead CMS effectively, raising questions about how these policies could impact millions of Americans relying on Medicare and Medicaid. So, as you can see, the future of Medicare is on the line as we head into the President elect Donald Trump's second term. With Dr. Oz heading CMS, there's a lot of uncertainty about how these changes could affect you in the years to come. Time will tell how it will all play out, but for now, all eyes are on what happens next. If you want to make sure that you're staying informed about all of the latest Medicare updates and how these shifts could impact your coverage, or if you even just found this video helpful, please give it a like and subscribe to our channel to stay up to date on all things Medicare. And if you want to dive deeper into your Medicare options or do a plan review, click the link in the description below to schedule a completely free consultation with me where we'll go over all of your Medicare options. And after that, click on this link right over here for my next video on Medicare updates in 2025 that you absolutely can't afford to miss. Thanks so much for watching, and I'll see y'all in the next video.